Hi there, sir.
Hi.
Do you mind if I talk to you on camera for just a
No,
second?
I don't mind.
All right. So we'd like to just highlight, I think you were one of the first to get vaccinated here this morning.
Right.
So can you tell us your name and where you're from and what made you decide to get vaccinated?
Raymond, Washington. I stay nearby here in the zip code 60619.
Great. And what made you decide to get vaccinated today?
Well, a lot of family members have already got vaccinated, so it gave me the courage to come on down.
All right, I love that. And any problems? Did it hurt? Did any questions? Any issues?
It didn't hurt at all. Just it was fine, and so far I feel well.
All right, very good. And this was your first dose today?
Yes.
Okay, so you'll get your second dose on time.
Yes, I will.
All right. That's what we like to hear. Congratulations.
Thanks.
All right.
Good morning, everyone.
Good morning.
I am Z. Scott, president of Chicago State University, and I am so delighted to welcome you to Chicago State's campus for this morning's media event as we host Chicago's Southside Mass Vaccination Center. I want to thank Mayor Lori Lightfoot and the City of Chicago for their leadership and commitment to this center. Thank you, Mayor, for your invaluable partnership in this effort to provide equitable vaccination opportunities to the citizens of the South Side of Chicago. I'd also like to extend a welcome and thank you to today's speaker, Alderman Roderick Sawyer of the 6th Ward, and another strong partner of Chicago State and the community. Gloria Cozy, president of the Rosemore Community Association. Sharon Pincham, president of the West Chesterfield Association. Karen Wilson Freeman, who I know is on her way, President and CEO of the Chicago Urban League, and Dr. Allison Awadi, Commissioner of the Chicago Department of Public Health. Thank you all, and welcome to any other elected officials, community leaders, and partners for joining us this morning. Equity remains at the foundation of the work of Chicago State University and the work that we do every day on behalf of our students. The work is driven by our mission to provide a world-class higher education learning environment and to increase access to equitable opportunities for education for all students and the community that we serve. As the country continues to grapple with COVID-19, we must not lose sight of the seriousness of this pandemic. It has had a pronounced and enduring effect on communities of color. As Illinois' only four-year United States Department of Education designated predominantly black institution, Chicago State has witnessed firsthand the devastating effects that COVID has had on our students and our greater community. That is why we are committed to providing our communities with the vaccine opportunities needed to remain safe and healthy. Since opening on April 5th, our site has been a critical resource toward an equitable recovery. In order for Illinois to experience a robust post-pandemic recovery, all of Illinois' communities must be equipped with equitable access to the resources needed to bounce back strong and healthy. And that starts with each of us being able to vax up. I am vaccinated. I was afraid, but I took the vaccination because I understand that the risk of not getting vaccinated was high, and the health implications could also be devastating to myself and my community. And so with that, I'm encouraging everyone who is on the edge to take the vaccination. In closing, I am excited to announce that Chicago State will be fully open in the fall for in-person instruction, classes, activities, and events. So our events administrators are here, so sign up. We are going to offer our students continuous COVID-19 testing and vaccination resources that will be available right here on campus. We are going to have we have put in place a comprehensive operating plan that reflects a more traditional campus experience as we return to campus in a way that is both safe and robust. Our students told us in so many ways, we want to be on campus, and we are bringing campus back to life on the southeast side of Chicago. This vaccination site is an example of what can come from collaborations between community leaders and community-based organizations. We have a commitment to providing full access to the vaccine and information regarding the vaccine to our residents and surrounding communities. Again, I want to thank you for joining us here this morning. It is my pleasure to turn this event over to the Honorable Lori E. Lightfoot, Mayor of the City of Chicago, and my friend. Thank you, Mayor Lightfoot.
Good morning, everyone. Good morning. It's a great day to be on the South Side and a great day to be at Chicago State. C. Scott and I have known each other for a very long time. She was one of my first bosses when I was at the U.S. Attorney's Office, and I always do what Z tells me to do because she's guided by the right spirit. She has a great heart, she has a great integrity and feel for what people need. And what people need in this moment, particularly on the South Side, is access to this life-saving vaccine. So when President Scott reached out and said, we want to open up our doors, we want to help, I told my team, we got to make it happen because the need was so great and because also the importance that Chicago State plays in the life of Black Chicago, particularly on the South Side. So thank you, President Scott, for your incredible partnership. I want to say thank you to the entire CSU leadership team, some of whom were here today, and all the volunteers that are going to make this a very successful mission on the South Side. Let me also recognize Chairman Rod Sawyer, Chair of the Health and Human Relations Committee on the in City Council, but also a stalwart advocate for all things Southside Chicago. Chicago Department of Public Health Commissioner Dr. Allison Arwady, Rosemore Community Association President Gloria Cozy, and West Chesterfield Association President Sharon Pincham. Let me also recognize, excuse me, the Reverend Will Hall. Thank you so much for being here. But really, what you see in this room with these leaders is a commitment to making sure that Black Chicago on the South Side has access to the same resources as any place else in the city. And more on that in a moment. Today we're gathered here to formally celebrate the opening of the Chicago State vaccination site, which officially opened on April 5th. Located on our historic South Side at our beloved Southside University, this vaccination site has significantly allowed us to advance our equity-based and inclusion-driven vaccine equity strategy, which pushes vaccine into communities that need them most, as well as make progress in our overall mission to vaccinate all, that's right, all of our residents. As of right now, this site is administering 500 first doses a day, and as of April 14th, is using Pfizer vaccine for all appointments. CSU is currently ramping up capacity through additional walk-in appointments and eventual drive-in services as more vaccine becomes available, and has set aside and reserved the majority of their appointments for residents age 18 and up who are eligible to receive the vaccine under phases 1A, 1B, 1C, and located in these critical zip codes on the South Side: 60615, 60616, 60617, 60619, 60620, 21, 28, 29, 32, 33, 36, 37, 38, 43, 49, and finally 60652, 53, 55, and 60827. So South Side, we are calling for you to come to CSU and get this life-saving vaccine. We are working directly with a number of community-based organizations and local aldermen to schedule appointments for residents in these critical zip codes. And if you're tuning in right now and live in any of the zip codes I just listed, don't delay. Call right now, 312-746-4835. That's 312-746-4835. We need you to call, to go online, to get an appointment, to come here to CSU and get your vaccine. And if you do not live in a zip code supported by the CSU site, there's other opportunities for you all across Chicago. Just go to the website, zoc.com/vaccine. That's zoc.com/vaccine. And if that still doesn't work for you, you can go visit chicago.gov/vaccine finder. We want every adult in Chicago to get a vaccine. You can email, you can go online, you can call, but sign up now and get your vaccine. Now, folks, I also want to bring to your attention something that's critically important. And there's a reason for concern and why this CSU site is so important. Our recent COVID data shows two alarming trends, both of which directly affect Black Chicagoans. An increase in new cases and hospitalizations. In fact, the highest case rate infection in Black Chicagoans for the first time in a year. This new case increase is among Black Chicagoans ages 18 to 44 in particular, and it is the largest increase of any demographic in our city. Test positivity in Black Chicagoans remains high and increasing most recently at 7.9% when we're averaging about 5.6% in the rest of Chicago. And unfortunately, recent hospitalizations tell a similar story. And deaths are increasing in Black Chicago from COVID-19. Folks, you know, a year ago in early April, we stood and talked about the absolutely unacceptable but horrifying fact that Black Chicagoans were dying of COVID-19 at 7 times the rate of any demographic. We have worked our tails off since then in partnership with many. And let me recognize Ann Lee of CORE, who is here. CORE has been an incredible partner for us in fighting this virus in neighborhoods all over the Black and Latinx Chicago that needed testing, and now need vaccine. So thank you, Ann, and to the CORE team. But we can't rest, not when these numbers are on the rise. And while these numbers and case rates, infections and hospitalizations and death are increasing in Black Chicago, sadly, we continue to see the lack of vaccine uptake in Black Chicago, particularly on the South Side. We continue to make incredible progress in getting Chicagoans' first doses of vaccine, now over 50%. But there's a different and more disturbing trend in Black Chicago, especially on the South Side. On the South Side, the percentage not being anywhere close to 50% is in many instances a mere 12 to 19% of Black South Siders who have gotten the vaccine. So what we know is this: Black Chicagoans are once again getting sicker, requiring hospital care, and dying more than any other demographic in our city. But we are not taking this life-saving vaccine like we should and we must. As President Scott said, we understand the trepidation. We understand the fears and concerns. But join the tens of thousands of other Black Chicagoans, other Chicagoans overall, who understand that this is necessary to save your life, to save the life of a family member, to save a life of people you care about. If you want to get back to the things that we call normal, going to church on Sundays, being able to go out and enjoy yourself at a restaurant, grocery shop without fear, the common things that we took for granted before the pandemic, now is the time for us to step up. And let me repeat, the vaccine is safe, and it's safe for you and safe for others in your household. We can all turn these numbers around. The cases, the deaths, the hospitalizations, but we can only turn them around if Black Southsiders get the vaccine. We must do this before it's too late. We should not have people continue to die in Chicago from this virus when we have the life-saving vaccine that is free and readily available. We can do this. We can turn these numbers around if we rally together with the key partners that are here with us today: Chicago State, CORE, Alderman Sawyer, and other Southside electeds, neighborhood organizations. We need to send out the alarm to everyone that makes sure that Black Southsiders understand you must get the vaccine. It is safe. Come to Chicago State. Join your neighbors, join your friends and your family members. Get the vaccine. And at this time, I'd like to invite Alderman Rod Sawyer to the stand.
Thank you, Mayor. I want to say good morning to everyone. Again, my name is Roderick Sawyer, and I proudly serve as Alderman of the 6th Ward and Chairman of the Health and Human Relations Committee. I cannot begin to reiterate what Mayor Lightfoot just stated today as it relates to the Black community. I just want to give one quick personal observation. When I came in this morning, I saw my good friend Sharon, and my first reaction was to see Sharon was to hug her. You know, I had to check myself because we've been so used to greeting each other that manner, but with this, you know, we have to restrain ourselves. So if there's someone that you want to hug today, someone that you want to be with, someone that you want to talk to closely, and you have not gotten the vaccination, this is your prime opportunity. We cannot continue to let these figures daunt us. These figures are disturbing, and the Black community is always the one that gets the worst of the situation. We have to turn that curve around. So please, come out here to Chicago State, go to the west side, go to the north side, wherever you are. It's open up now. Almost every adult now is available to get the vaccination. Make your appointments, get it scheduled, get your shots, because there's someone out here that wants to give you a hug, that wants to be next to you. So please, let's not take this lightly. I'd now like to introduce the next speaker, also a very good friend, the president of the Rosemore Community Association, Ms. Gloria Cozy.
Thank you, Alderman Sawyer. Thank you, Mayor Lightfoot, President Scott. We are so grateful to have Chicago State as a resource for the vaccination. On behalf of the Rosemore Community Association and the other surrounding communities, we will absolutely do our part in pushing the word out, sharing this information, sharing this site to our residents so they too can come and get vaccinated. I was astounded to hear the low percentage of the Blacks on the South Side that is not vaccinated. I get called all the time. We have access to a lot of community residents, and we will absolutely do our part and continue to push and reach out to them, make a special effort to encourage them and to help them to come and get vaccinated. Thank you again, and we are really excited and grateful for this site to be right in the community. And now I hand it over to Sharon Pincher.
Good morning, everyone.
Good morning.
First of all, President Scott, Mayor Lightfoot, Dr. Arwady, we appreciate you being looking at our community and being able to see that we have a need that needs to be met. And I can't say how much and how proud I am that it's here at Chicago State University in my community, my alma mater. personal thing here. And, you know, just the fact that we can also share the information in our communities. I reiterate what Ms. Cozy said in the fact that, you know, we get questioned all the time. We get asked all the time. We get challenged all the time as to why should I get this vaccine? Where can I get this vaccine? You know, the questions are out there. So Chicago State's a resource that we can use. It's a resource that we can point to, and also probably lend ourselves to get education for our community, because that's another major thing that's missing. We have a lot of comparison. I talked to a young lady last night of 79 years old who was leery about the fact that she should get the vaccine, and refers to the historical nature of the fact that we have been used as guinea pigs, and I'll say that. This is not a guinea pig situation. This is a life and death situation. So I applaud everyone here who made this happen today, and look forward to working with you in the future. Thank you. Now I'd like to introduce Dr. Allison Arwady.
Thank you so much. And I have to start with thanks to President Scott and to Chicago State University. Just amazing to have such an important institution in one of the areas that we most need to improve vaccination coverage step up and say, not only can you use our space, but we want to be really heavily involved in the outreach, in the planning, in the messaging. We've seen a lot of people offer space, but not everybody want to be as heavily involved, and I really want to thank you for that. Also want to give my thanks to CORE, who certainly have been with us all along the way here, have shown the ability and how important it is to hire folks from communities as we're thinking about bringing in people who want to help get communities vaccinated. And then, of course, to Howard Brown, who are the clinical providers on site here. Every one of our sites in Chicago has a clinical provider. You've got to make sure there's someone who's licensed, that all the vaccines being drawn up appropriately, that every single step is being covered. Howard Brown has been an amazing partner on that at a number of sites around the city, and really appreciate you stepping up. And then, of course, thanks to the aldermen and all the community leaders and really everybody who is getting the job done here. This site originally opened as a Johnson & Johnson site, given that we had heard a lot of interest in the one and done vaccine. And I want to just mention quickly that when the Johnson & Johnson vaccine went on pause last week, this was the first site that we said we have to make sure that vaccination doesn't go on pause here, that we switch over to that Pfizer vaccine. But most, I want people to hear that this vaccine is safe, is effective, and increasingly is available to everybody who wants it in Chicago. The data is fantastic on safety. We've had more than 200 million Americans get this vaccine. We've had more than 1 million Chicagoans get this vaccine. And as you heard the mayor say, more than half of the adults in Chicago have now gotten at least a first dose. So if you see an adult on the street here, chances are better that they've gotten the vaccine than that they haven't. But particularly among Black Chicagoans, that has been lagging. If you look at all Chicagoans, not just adults, we're at about 40% have gotten that first dose. But across all Black Chicagoans, it's about 25%. So still, 1 in 4 have already made that decision to get the vaccine, more every day. But we do have some extra work to do. And so sites like this are absolutely critical. I want people to hear that out of all of this vaccinating that has been done, the great majority of it with Pfizer and with Moderna, we have not seen safety concerns. I was in clinic last night myself seeing patients, and I saw a wide range. It was a good reflection of, I think, where the city is on vaccine. Some of my patients had already gotten vaccinated. No problem, they were excited about it. Some of my patients said, I want to get vaccinated. I'm still not quite sure how to do that. And for them, through clinic, I was able to get them an appointment. But for everybody in Chicago, all adults are now eligible. and I want you to hear this phone number, 312-746-4835. Hundreds of people are standing there ready to help you get an appointment near where you live, anywhere in Chicago. If you're online, ZocDoc.com/vaccine is going to be your best place. And for the first time this last week, we had enough vaccine to send to every provider who wanted it. We haven't seen that in 4 months. So vaccine is available, it is safe, it is effective, and I want to really thank everybody who's gotten vaccinated today, setting that good example, and welcome everybody to Chicago State and to everywhere across Chicago as we keep getting people vaccinated. And with that, I will bring Mayor Lightfoot back up for questions.
All right, happy to answer any questions you have.
Could I ask Dr. Scott a question?
Yeah, sure, of course.
For when the students come back, will they be required to be vaccinated?
You know, that is a decision that many universities are making across the country, particularly our public universities. We're actually waiting on guidance from the Illinois Department of Public Health and the Illinois Board of Higher Education on that issue.
And do you have any timetable on that?
No, I don't have a timetable yet, but we are waiting on some guidance.
Thank you. Dr. Arwady, do you believe the mandate on outdoor masks will soon be lifted?
I wouldn't use the word soon just yet. I'll remind you that we are at a high risk level here in Chicago from COVID, although we have seen some signs of that flattening just in the last few days. Before we're really thinking about not having masks in public, I want to see a high percentage of Chicagoans vaccinated, and I want to really make sure that our numbers are back down in a range where when people are out and about in public, the risk of them potentially, being exposed to someone with COVID is low. As a reminder, if you are wearing a mask in public, that's to help protect you, that's to help protect everybody around you. In private, if you are fully vaccinated and everybody else you are gathering with is fully vaccinated, the risk is extraordinarily low of getting COVID. That's the promise of vaccine. But in public, still at this point, masking is one of the easiest things that we can do to help protect everybody while we're still working on getting folks vaccinated.
From one of my colleagues, has anyone been fined for the city's travel order?
So related to the city's travel order, the primary reason for it, as you know, has mostly been education, highlighting that there are places in the country that it is high risk to travel to. We have issued warning letters. We have done follow-up. To my knowledge, I don't know that we have fined anybody. But again, the goal is not to bring in revenue for the city. The goal is to make sure that people have the information and get the testing that they need. Increasingly, again, as a reminder, if you are fully vaccinated, you do not need to quarantine after travel. Another good benefit of getting vaccinated.
Do you see a day where you're going to get rid of this travel order since the vaccine has been so widely spread?
Yeah, I think certainly we look at it every week, and as more and more people are vaccinated, it applies to fewer people. I think what we're going to see is increasingly there will be less need for these kinds of municipal travel orders because we may see airlines, for example, requiring vaccination status or potentially a pre-testing requirement to travel. I think there's going to be more and more incentives for people to be vaccinated who want to travel, and it will increasingly be safer to travel. But we are still, we are clearly in, another uptick here in terms of COVID in the U.S. I wish I could say we were past it, but we're just not at this point. So at the moment, really encouraging people, getting vaccinated is the safest way to protect yourself, and then you can do a lot of these other things like travel with much less worry, much less need for the testing or the quarantine or any of those pieces.
This could be for Dr. Arwady or the mayor regarding fans at the United Center, both the Blackhawks and the Bulls. Of the 30 teams in the NBA, the Bulls are the only team really without a timeline to allow at least even partial attendance by fans. Is there something something in the numbers that you see preventing the city from allowing fans back into the stands at the UC?
Well, first of all, we're talking to both the Bulls and the Blackhawks. I think they've got very solid plans, but those plans were rolled out at a time when we were on the upswing and the surge. As Dr. already said, and the numbers bear out, we feel like we might be plateauing and even dare to dream going down. Going down is the right time to have that conversation. So we'll continue with that, and I expect before season's end that there will be fans in the United Center. Any other questions?
First of all, just clarifying something about this site.
Yes.
Is it only for people in those zip codes that you listed, or is it open to anyone in Chicago?
We are primarily focusing on those zip codes because of the reasons that I laid out, but anybody in Chicago can come to one of our city sites. But Chicago residents.
So we've got a situation where, in effect, you can lead a horse to water, but you can't make them drink. The vaccine is available, but you're still running at hesitancy. What differently do you need to do to overcome that?
I think it's a continued effort around education. You know, as you heard, I think it was from Ms. Pincham. You know, people have questions, they have concerns. Yes, we've been doing vaccinations since December, but some folks are just now tuning in and want to be educated about, you know, is it safe? What are the different vaccines? How do I get it? Making it simple and easy for people to access it, giving with trusted community partners information that they can share in their block club meetings, in their churches. We've just got to keep doing the outreach and the education because not everybody is following this every single day like many of us are. Everyday Chicagoans are worried about a range of things, and of course they worry about their health, but I think we've got to get people off the wall, if you so to speak, and really get them in the game. And the game is education and then action.
Off topic, talk about things that are of concern. You've asked for the National Guard to come in. What does this say about how concerned you are about something happening with the Chauvin trial? And what are the city's plans to protect businesses and protect neighborhoods?
Well, the National Guard is on standby. It's about a 36-hour cycle if we need them. So I reached out to the governor last week and talked to him. We've been talking really all along, but officially made the ask to put them on standby so that if we do need them, and hopefully we won't, that they are here. We've done that. You haven't seen it, but for example, when we knew that the grand jury was going to be releasing information about the death of Breonna Taylor, we had the National Guard on standby. They were on standby during the time leading up to the federal election last year. We learned a lot over the course of last summer and fall about additional things that we needed to be doing. Last week, we activated what we call our neighborhood protection plan, which is putting our officers on high alert, very visible, canceling some days off, making sure that we have the resources in addition to CPD, with sheriff's police, with state police, and our infrastructure departments. We have over 300 assets out in neighborhoods and downtown protecting commercial corridors. So that plan has been in place really since last week, and it will continue to be in place at least through the verdict, and we'll see what happens, you know, today, tomorrow, whenever the jury comes back. But we've been in constant contact with business partners all across the city. We've been doing security briefings for some time now with them because of our concerns about what might manifest given the Chauvin trial. So I think we've got a very robust plan in place, really honed through our experiences last summer. We've done a significant amount of live drills and tabletop exercises, really trying to anticipate any potential scenario. So I feel like we as a city are way better prepared than we had been to keep our residents safe, and we're communicating that to stakeholders across the city.
Are the National Guard arriving today? Is that correct?
Some parts of them will be here today, and then probably the rest tomorrow.
Just one more follow-up on it. There are some community groups holding a news conference, probably as we speak right now, criticizing you, saying bringing the National Guard in sends the wrong message, militarization or whatever. I don't know exactly what they said, but you know the type of criticism that's coming from these community groups is that this is not the right way to handle it.
Well, here's what I know. I know that a lot of people in our city are concerned about their safety and want to make sure that we are doing absolutely everything that we can to get people safe. If we didn't prepare, and God forbid something happened, those groups wouldn't be standing with me and say, the mayor made the right call. They would fade into the woodwork. They would fade into the woodwork. My responsibility is to learn from every experience that we have and make sure that we are better prepared because of that learning, and we are. So we have them here. They are on standby. If we need them, I will not hesitate to pull that. Make sure that we put them into action.
And finally, and you did sort of address this, but could you be a little more specific?
Yeah.
How has CPD's response to protests changed since the February IG report found that the department failed both the officers and the community last
Well, unfortunately, that February IG report was, the information was about 2 to 3 months old, and for reasons that, in my view, are unacceptable, didn't take into consideration and give the department an opportunity to actually respond. And the way in which it's changed is our officers are getting constant First Amendment rights refreshers. They are doing tabletop exercises and live drills to make sure that they are on point, particularly when it comes to proper constitutional protection of protesters who are exercising their First Amendment rights. The superintendent put out a letter that the IG belatedly listed but didn't take into consideration. But there's a lot that has been done to make sure that the department is honoring its responsibility to protect protesters who are safely and peacefully exercising their First Amendment rights.
Can you tell us where the National Guard will be stationed? Last summer they were...
No, I won't. I won't.
Perimeter.
I won't.
Be in the neighborhoods.
No, they're on standby, so they're not actually going to be activated unless we need them. So they'll be available and close, but on standby, but physically present in Chicago, but not running posts like they did for a little time last summer. If we need them, they're here. My hope is that we will continue to see what we've really seen since last fall, which is peaceful expressions of people's emotions, First Amendment rights, but my hope is we won't need to deploy the National Guard.
To those who use this as an advantage to loot, riot,
Don't test us. Don't test us. Hold on one second, let me just finish. We are ready, we are prepared, and we are ready to arrest and bring to prosecution anyone who would dare try to take the dreams of our small businesses by looting. Don't test us, because we are ready. Thank you.